Hello, my name is Aaliyah Jung, and today I'll be talking about one of the most dangerous drugs impacting our communities today, fentanyl. What is fentanyl? Fentanyl is a synthetic opioid created to manage severe pain, but it's also 50 to 100 times stronger than morphine. Originally, it's created for the use as an intravenous anesthetic and pain reliever, and it has a high potency that makes it both effective and extremely dangerous. Just 2 milligrams, it can be fatal. It's also man-made in laboratories both legally and illegally. What are IMFs? IMFs are illicitly made fentanyl, includes unknown chemicals that may lead to overdoses in life-threatening circumstances. Synthetic opioids created in illicit laboratories are regularly discovered in powder form and marketed as counterfeit pills. Mexico and China are the major sources of fentanyl, and similar chemicals smuggled into the U.S., mostly by cartels and illicit sales. Legal and illegal uses. In medical settings, fentanyl is prescribed as patches, lozenges, and injections for patients with chronic pain. It's also used for cancer patients as well. However, fentanyl that is made illegally has become a big problem. Drug traffickers often combine fentanyl with heroin, cocaine, meth, or counterfeit medications to boost potency and profit. Because these counterfeit pharmaceuticals sometimes resemble real prescription medications, consumers may be unaware that it might contain fentanyl, which significantly raises the risk of lethal overdoses. The scope of the crisis. Over 70,000 overdoses deaths in 2023 involve synthetic opioids like fentanyl. It's responsible for 2/3 of all overdose deaths in the U.S. Overdose deaths increased by 38 from 2019 to 2020. Drug Enforcement Administration seized 379 million lethal doses of fentanyl in 2022. Every region of the U.S. has seen a major increase in fentanyl-related deaths. Illicit fentanyl is the main driver of the current overdose epidemic. And this is also the recent data graph of the fentanyl deaths reached in 2022. How fentanyl affects the body? It attaches to our opioid receptors in the brain to block pain and create euphoria. It slows breathing, heart rate, and brain activity, leading to possible respiratory arrest. The difference between a safe and deadly dose is extremely small. Even minor accidental exposure, like touch or an inhalation, can be harmful or fatal. And the overdose symptoms are pinpoint pupils, cold blue skin, and unresponsiveness. Prevention and solutions to opioid overdose. Education and awareness are key to preventing fentanyl overdoses. So you can avoid non-prescriptive or counterfeit pills. You can use Narcan to reverse opioid overdoses when administered quickly. Expanding addiction treatment and mental health support is essential. Reducing stigma around addiction encourages recovery and community support. Community-based prevention efforts are key to lowering overdose deaths. And here are hotlines and help resources. You got SAM, HSA, National Helpline, Poison Control, and the National Harm Reduction Coalition. Thank you, and this is my educational infomercial presentation. And here are the resources as well.